Hi friends. Welcome to Dentistry Love channel. Avulsed tooth, Part 1. Definition. Avulsion is defined as the complete and total displacement of the tooth from its socket. Incidence of avulsion varies from 0.5 to 3% of traumatic injuries in permanent dentition and 7 to 13% in primary dentition. Radiographic imaging. 2 periapical radiographs from mesial and distal angulations. CBCT should be considered to confirm the reposition of the tooth and rule out alveolar bone fractures. Instructions. Carefully hold the tooth by the crown and gently wash the tooth in running water without brushing or cleaning it, and examine it to be certain that the tooth is intact. Avoid touching or scraping the root surface of the tooth. Have the patient to rinse his/her mouth. Replace tooth in its socket using gentle, steady finger pressure. If the patient is cooperative and able, have the patient gently close the teeth together to force the tooth back into its original position. Take the patient to the dentist immediately. Here's the picture of cleaning the avulsed tooth for your reference. Classification. The tooth has already been replanted at the site of avulsion. The tooth has been kept in special storage media with the extraoral dry time less than 60 minutes. Avulsed tooth has been stored for an extraoral dry time of more than 60 minutes. The tooth has already been replanted at the site of avulsion. Treatment varies for closed and open apex of the tooth. Immediate treatment for open and closed apex. Leave the tooth in its place. Clean the affected area with water or saline for 10 seconds. Suture gingival laceration, especially in the cervical area. Verify normal position of the replanted tooth radiographically. Apply a passive and flexible splint for 2 weeks, 0.016 inch or 0.4 mm. Initiate RCT within 2 weeks of replantation. Calcium hydroxide intracanal medicament for 4 weeks followed by obturation. Then, splint is removed after checking for proper periodontal attachment radiographically. Endodontic treatment. The goal for replanting developing and immature teeth in children is to allow for possible revascularization of the pulp space. For very immature teeth, RCT should be avoided unless there is clinical or radiographic evidence of pulp necrosis. If pulp necrosis is diagnosed, pulp revascularization or RCT, apexification, is recommended. Thank you friends. Please do subscribe for more videos.